Welcome, my beautiful friends. This is a Time to Care the Caregivers podcast. I'm Isabel Melgarejo, your host. And today, with me, I have Claudia Cometta. She is a pharmacist turned into a healthcare coach. So, welcome, Claudia.
Thanks so much for having me. Honored to be here.
So, what can you tell us about what you do and how you discovered your passion?
Yeah, well, let me figure out how to say that concisely. No, I know that you and I share similar passions, and our details of our work might be a little bit different, but I'll kind of encapsulate the journey as concisely as I can. So, I was a clinical pharmacist for many years since 2003, worked alongside healthcare teams in a variety of roles and jobs, most of the time working along teams to manage high risk medications for patients, but also as a primary drug information resource. And um, so about a decade and a couple years into my work, my dad was diagnosed with lymphoma. And that whole journey basically catapulted me into a completely different perspective on our healthcare system, such that, I basically became a patient, or at least a patient's advocate, for a significant period of time and saw the healthcare system from a different side, one that I had not seen in any significance, which is really the patient experience side. And it's kind of sad in a lot of ways that it took me that many years to understand and realize what patients are experiencing, but that's the reality. And then I couldn't unsee what I saw. And so I basically decided I was not going to be able to make the impact in healthcare that I wanted to make in the same roles that I had been employed in. So I made a very heart-centered decision, meaning the analytics had to go, because it didn't make any sense for me to start a business. I was not a business person. I did not have an MBA. And so there was no logical or analytical justification for what I did. But I knew that I needed to do for others what I did for my dad. And so in 2017, I opened up what was then Peace Advocacy Group. I've since rebranded to Avanti Health Consultants. But the work remains the same, which is patients come to me in a variety of circumstances. So that could be an adult child calling me on their parent who's in the ICU. It could be a parent of a young kid. So I have some kids who were like 8 years old, and their parents are asking me to help them navigate the complexity that is the healthcare system. So how do I get diagnosed with what I need to be diagnosed with? So clarity in diagnosis. And then how do I optimize my health? So how do I either get out of this acute situation? So how do I get out of the ICU and onto my health journey? Or how do I optimize where I'm at? Which specialists do I need? What medications am I currently on that are a concern? How do we clean all of this up and achieve a level of peace and clarity, which sounds to many like an impossibility, because it really is such a difficult system to navigate. But with the right team and the right resources in place, it's very much a possibility. So it's been a very fulfilling path for me to get people to that reality. And so that's what I do.
I I feel the healthcare system is missing some kind of guidelines where they can give you these are the steps that you need to follow. This is the people that you need to connect with. Just go
Yeah.
ahead and talk with these people and do these steps. But my father-in-law, he had open heart surgery about a year and a half ago. I want to say it was either a year or a year and a half ago. And they gave him like these guidelines that were so complex. And it was booklet after booklet after booklet. And he didn't know where to start, how to make sense of it all. So obviously, someone like you that can make sense of all the complexities and connect people to the right suppliers or get the right help, I think it's very useful. So,
Yeah.
what were
People are in that situation every single day. So I appreciate you sharing how that's touched you in your life. And most everybody can relate and can think of at least one example of that, if not 100. So yeah, it's definitely more needed. There are some facilities that employ somebody called a patient navigator or called a patient advocate. The caveat to that is they are employed by that facility. So Number one, they aren't going to tie in pieces that are outside of that facility because that's the only facility that they work for. And the second piece is they are functioning under a conflict of interest. So there is not going to be a time when they're going to say, hey, this medical provider doesn't appear to be acting in your best interests. They obviously can't say that within that system. So it's not that there is no benefit to what they do, but it is so limited. And somebody like me who works independently and has no conflict of interest is a value in a lot of ways.
And of course, everything, if you're in and out for something simple, maybe you don't need a health advocate. But when you're dealing with health issues that are not going to be over in a matter of weeks, but you're going to have like there's a process to it. It's cancer or heart disease, diabetes, anything that is long term. I do feel that you need someone that helps you navigate
Mhm.
because
Yeah.
it's not just that moment.
No, for sure. I actually advocate, encourage people to sort of identify who that person's going to be, even if you don't need them right now, but have your sort of ducks in a row because should you, God forbid, end up in the ICU and a family member needs to find somebody to help, that's not a really great time to start doing the research. So yes, you may not need them right now, but at least know who that's going to be and be ready to call them.
That's the whole thing I do. Be ready. Have the right contact information because when you're in the midst of whatever, you're not going to have time or a head to do the research, to connect with people, to interview them and get to know what they're offering. So, how do you help them? Do you start with the end in mind? We want to accomplish this sort of health. How would you start working with anybody?
Yeah, so it's a great question, and the way that I sort of onboard my clients is starting with what their top three goals are. So, what does it look like if I successfully do what you want me to do? So, I provide the services that you are seeking. What does that look like in terms of goals? So, what are your health goals? Now, if we're in a situation where it's a family member calling me about a loved one in the ICU, obviously the first and primary goal is to successfully and safely get out of the ICU. So we need to get out of that crisis and then we can talk about goals. But assuming we are not in the ICU, we're not in a critical state, we're talking about what are the goals. So I do not exert my control over the situation with regard to what my goals would be for the patient because it's very much individualized and interestingly enough, most medical practices don't ask patients this. And so it's a question that is more difficult to answer than you would expect. The practices, what we have been shown by both society and generations that have come before us is we go into a medical situation, and we just wait for them to tell us what's wrong and what we do next, right? We're sort of passive recipients of whatever's going to happen. There's very little proactive involvement in us saying, oh, hey, by the way, this is actually what I would like from our, our relationship together and our time together. And here's what would look really great for me. I would love for in 20 years to be able to be running around with my grandkids or whatever the case might be. Or, my value system is I would like to limit the types of prescription medications that I take. I would like to take a more holistic approach. These conversations just don't happen in general. So we start with that. What are your goals? And then based on those goals and what I am evaluating in their previous medical records that they've shared with me. So, I'm sort of bringing that objective data. Here's objectively what has looked like has happened. Let's pair that with your goals and what you're telling me and let's lock arms and move forward and make that happen. So if it is, I want to take a much more holistic approach, then we might need to create a team that supports that. So maybe we still have a traditional primary care provider, but we're also incorporating maybe functional medicine. And so we're putting the team together. So I am not acting as their physician in any way. I'm not prescribing anything. I don't have legal authority to do that. But what I am doing is functioning sort of as if like the general contractor who is, subcontracting, I'm like pulling everything together. So what do we need? How do we get there? Some of that I can provide depending on what it is. Some of that I might need to pull in practitioners, get your medical team together. For a lot of my clients, I'm very much in the details of their entirety of their care, meaning I'm either physically at their doctor's appointments or I'm on speakerphone. So, depending on their level of desire of my involvement, so some want me involved in every aspect and they'll tell me all of their doctor's appointments and I have them all on my calendar. And others are like, just kind of get me out of this immediate situation and then I'll like kind of reach out to you when I need you. And so everybody has their comfort level with how to manage their own healthcare journey. And so I'm there for whatever level of involvement they want me to have.
And I really liked your approach into having your goals and what you're expecting from this situation, because I don't think we ever stop to consider what we're expecting our health to be. And we just assume that our health is it is our right. It is the regular thing is to be healthy. But when we're not, we never stop to consider how we want to regain that health. So, how do you start thinking about these topics? Because I wouldn't know where to start. I wouldn't know. Now that you have said something, it's like, oh, for me, I would like to have a more holistic way, and I would like to have mindfulness in the journey and probably combine it with mental work. So I address my health in many different aspects of life, but how do you help clients identify those goals?
Yeah, well, I mean, this perspective, like sort of paradigm shift, came about mostly through my journey with my dad because I only knew what I knew back then, and it was very limited and it was very much tied into what the traditional medical system offers. And so I was navigating only within that system. I mean, I did add in like a nutritionist, but I did not think expansively with regard to his health. And so I sort of went through a period of reflection of what did not go well with that. What would I do differently now? What do I know now that I didn't know then? And so I really incorporate all of that. And so, we talk about and once you give people the almost permission, not that anybody needs any permission, but some of us, we function in life very much mostly because it's how we've always functioned. When we grow up, we are seeking permission. We need permission from our parents. We need permission from our teachers. We need permission to go to the bathroom when we're in class. We need permission. And so we are we're sort of trained mentally to seek somebody else's approval of what we're about to do before we do it. And so it's almost like I'm basically giving my clients permission to start from the very beginning, taking a more proactive, independent, being more responsible for their health than maybe they have been given permission to do before. So rather than this very passive approach of, okay, you come to me and then I just dictate the entire journey, which is what most people are used to, we are very much co-creating. So you tell me what you want out of this. I, of course, will point out some of the very obvious, objective concerns regarding your health based on your lab work, based on your symptoms. So we're working under scientific information. It's not like it's all anarchy, but the point is, combining what we know objectively along with what the client actually wants. And so some people are like, don't talk to me at all about, here's one thing I've heard people say, hey, my aunt tried to go the holistic route with her cancer and she ended up passing away. And I am not open to that. I don't want to hear one thing about an herb, a supplement, and anything. Right. And so if that is a value system, now obviously, I could go through a multitude of we could talk more about that and what actually happened and maybe the approach wasn't right. But in any case, it's not my place to say you're right or you're wrong. My place is, okay, you are in a spot right now where what really is true for you is staying mostly within the traditional Western system. And that's great. I know how to work that system very well. So let's maximize and optimize that system. And if that changes, if that's a fluid thing that changes in the future where you want to incorporate a more holistic, non-traditional approach, we can do that. But right now, if your goal is we're gonna stay in this lane, let's stay in this lane and optimize it. And so it really starts with that open conversation and permission. Like, people don't know they even have the permission to have a say in anything that's going on in their healthcare. They may, in their minds and in their hearts, have an idea of what they want, because when a provider is telling them something that's antagonizes that or goes against that, they don't feel good. It feels misaligned, but they aren't verbalizing it because they don't think they have the right to or they have the permission to. So we stay in this state of just struggle and frustration because nobody's listening to me. But number one, we might not have the right team, and number two, you haven't been given an open door to express what's happening internally to you and what you feel. So we start with that, because we can't move forward in any effective or productive way if we don't.
I was I think I was in college, and it was after my dad passed away. And I just had these horrible stomach aches all the time. And I went to so many doctors, and they just couldn't pinpoint what was wrong with me. And it was so bad. And in my engineering brain, I started recording absolutely everything, like how I was feeling with the medication, if it had effects. And I came to the doctor, and I had like all these beautiful printed charts. And I was like, whatever you're telling me to do is not working.
Yeah. Yes. I love that. How did
And
they like your charts?
he told me that he had never seen charts in his life from any patient. So I was the first on that one. And eventually I had a cyst, and it was like super easy fix, but it did took several months for doctors to figure out. And I was going between gynecologist and gastroenterologist. All of them were like, we don't know. But I don't think we feel open to just share with the doctor and provide our expertise, even though we know our bodies better than the doctors.
Mhm. Yeah. I talk about this a lot, both in my book, but also with clients. Is In fact, I just had this lengthy conversation the other day. And that is, we don't recognize or identify our own expertise on our body. We are taught to recognize knowledge from a book, which is what doctors have. And I don't discount that at all. My husband is actually an anesthesiologist. He's a doctor. I have watched the entirety of his medical training and career, and it is intense, and the amount of things that they know is extreme. So I don't discount that or take that away at all. But what we need to realize is there needs to be a meeting of our expertise over our bodies. Nobody could possibly understand what we are feeling any better than we can. It doesn't matter what the labs say. I mean, how often do we hear the labs look completely normal, but we feel like trash? I mean, that's very common. And so our expertise on our body has to be met with the expertise of the physician for this to work. And that requires an open door of communication and a level of humility on both sides, right? So, like, the physician
Mhm,
needs to come down a little bit on the level of superiority in the relationship, and also the patient can accept the extreme knowledge base of the physician, but also bring themselves up to be an expert in that conversation, just in a different way. And so that we have to sort of shift our paradigm completely, because the way that most of us grew up is our parents took us to the doctor, and we were taught without verbally being taught that we go to the doctor and we sit and we wait for them to tell us what's wrong, and we wait for them to hand us the prescription, and we go on our merry way. We don't ask questions because we don't know anything. They know all of it. And so we answer what they ask us. We stay quiet. We don't want to question their authority. That's disrespectful. And so we have a lot of just belief systems, whether they were directly taught to us or just indirect by what we witnessed. And so we have to change that, not in a way to be antagonistic or in a way that is disrespectful, because there's no need for that either. But there is a need for a collaborative relationship, or it just doesn't work.
I agree. And I think we need to start raising our voices, because I'm pretty sure you've experienced a lot of your clients that have the same medication with different names that do the same thing, and they're taking three different medications for the same thing. If we were open and we were asking what this is for and how is this going to help me, then we would figure out that, oh, this is the third time a doctor is telling me that I need to take something for this. And I can say, like, I'm already taking this medication. Do I need to adjust the prescription? What do we need to do? Instead of just trusting blindly that something has to be done, and then we're hurting ourselves
Mhm.
unintentionally.
Yeah. Yeah, there are a few elements of the system that contribute to this. One is that the system is just overburdened, so the time that the physician has with the patient is so minimal. So they are working within this time constraint, and that does not lend itself to, unfortunately, to a long explanation. A second element of this that is contributing is that there is a general assumption that most patients aren't gonna understand. There's also a concerning assumption that all patients want is a prescription. They're looking for a quick and easy fix. And so it's almost like the physicians feel like they're giving the patients what they want. Here's your fix, here's your next fix. Because that's what they want. They don't want to make lifestyle changes. They don't want, they don't want all this stuff. And I have had many conversations with medical professionals about I understand how this assumption could exist. However, because people come to the doctor's office with, "Hey, I saw this I saw this medication advertised on the TV. I want this one." And so they hear this over and over and over, and they become jaded. Like, this is all anybody wants, so here's your prescription, go on your merry way. But, my argument to that is, without really arguing with them, but it's more of like a debate. So my debate with them is, I understand how you could assume that that's what patients want, and there's probably a small percentage of patients that don't wanna hear anything other than the medication. That's probably true. But I would say, if you were to give the patient the option, if you were actually to open a door of conversation and say, I can either give you this medication, you can just take this forever and you will feel mediocre, probably worse because of side effects. Or you could make these changes in your life and I can make sure you have the right resources to make these changes and you'll feel great and not need the medication. I mean, most people are gonna choose the other option. Now, whether or not, they establish the habits that continue the sustainability of that lifestyle change, that's gonna take the right resources, the right coaches, etcetera. But if you were to just open the door to that, like, here's the options, I don't think most patients are picking the former. I think they're picking the latter. I could be wrong, and will stand corrected, but most people I talk to, w nobody is that I know of is sitting around saying, "Man, I really wish I could take more medication." Nobody's actually
No.
saying that. And so I think there's just this, I talk about this gray space in between the doctor and the patient, and in this gray space is filled with a lot of things, and one of which is biases and assumptions, and that is one of the assumptions that exists, and it's unfortunate, but it does.
Yeah. So, how do people graduate from working with you?
Yeah, I should have a graduation ceremony ceremony, right? So I don't actually it doesn't actually happen as a final graduation. It's more so I have had patients who, like, we're getting through the initial crisis, right? And once we're through that and they feel like they have a good handle on their health, they would, I guess, be considered a graduate. But they also know that I am here to recontact at any time. So I'm kind of still in their lives, but just at a much lower frequency. And so now, like I said, I have some patients who have no desire for graduating, and they just want me to be involved because they feel a sense of peace having me there. And so it really is kind of an individual preference. But I would say, the graduates are more of the people who contacted me more for a, like, finite project, where we're either trying to get out of the ICU or we're trying to get a medication approved that, they've been fighting for with insurance for 2 years. And so it's like a finite project, but they also know that they have access to me, later if they need my help.
So, you help with, I know that you help with the medical journey and the insurance journeys. Is there anything else you help people with?
I would say I tell people, if there's something on your healthcare journey that is frustrating, just reach out, because if it is not something in my wheelhouse, it is not part of my zone of genius, I will find somebody. So, the connector piece is arguably just as important. So if there's something that you need, what I find is people oftentimes will seek out expertise for a medical problem and it's not a good fit, but that other person will go ahead and try because it's another customer. And then you've got years of paying somebody who hasn't done anything. For instance, I had a client who was trying to get a medication authorized and that kept getting denied to the physician. And so their next call was to a lawyer, which, okay, I guess I could maybe see that. But while a lawyer can write, intimidating language very well, they don't know the ins and outs of the system. So it literally took me a couple weeks to go through the records. They had been working with a lawyer for two full years trying to get this approved. And so they just kept sending letters and threatening letters and didn't get anywhere because they don't know how to actually work the system. So what needs to happen is a better explanation of why the patient needs this medication. And a lawyer can't do that because they don't have the medical knowledge. So a lot of times it's just reach out to me. And if it's not me, I'll at least guide you to the right person. Otherwise, you're spending months, years with the wrong expert and not getting anywhere. So, yeah.
So connect with you. So how can people connect with you, learn more about you, buy your book, all of the
Yeah.
things?
So my book is available on Amazon. That's probably the easiest, most accessible for most people because most people have an Amazon account. So if you just either search my name, Claudia Cometta, or the book title, which is Patient Empower Thyself, you can find my book. You can also just go to my website, which is consultavanti.com. So CONSULT, like consult, Avanti, meaning forward. So we're moving forward, and that's a forward in Italian. So AVANTI.com. You can also just email me. It's Claudia@consultavanti.com. So all of the ways, if you just want to go to the website, or if you're on LinkedIn, connect with me on LinkedIn. So Claudia Cometta on LinkedIn, and then all of my links are in the bio there too.
Is there anything else you want to share with us before we say goodbye?
Oh, I have so much to talk about. But no, I think we had a really good conversation that covered a lot of ground. I would say I certainly would hope that the $16 that my book costs is a great value because I share a lot. What I would say is this is less about collecting more information. So our society is very much about like how do we accumulate more information and get more degrees and titles, and navigating the healthcare system is much less about being an intellect, but having a different perspective and paradigm around how you're going to approach your healthcare. So you can pull in the people with the knowledge. You can pull me in. You don't need to have the knowledge, but you do need to have a different perspective of how you're going to approach your healthcare than what we have historically seen with generations before us. So that's what I would leave the audience with is this is a paradigm shift more than go to the internet and start Googling or chat GPTing more information. Information is not what we need. We need a different approach.
I agree. And I was talking with someone the other day about this app that it's designed just to ask for people to ask questions just about healthcare. So even if you want to go the route of AI, choose the right tool.
Mhm. Agreed. Agreed. Yeah, I do think AI is gonna have a role. I think it can start to guide us in a direction. What AI can't do is, assimilate information that's not just hard data. So, to have a perspective that's very connected to humankind, understanding on a deep level how physicians approach things, what language they're using. So it can help in some situations where you're just trying to pull in like, hey, this is what my can you look at my scan? Hey, whatever GPT, can you look at my scan and let me know if my radiologist made any mistakes? Very objectively, we can look at things like that maybe with AI. I think when we're trying to pull in pieces together though, it's still lacking maybe one day, but there's a lot of pieces that it's missing.
Yeah. And we're getting there. It's just finding the right tools. And I don't think ChatGPT is the right tool.
Mhm.
That is the general tool for everybody to write an email and don't worry about spelling or grammar mistakes. But if we really want to pay attention in terms of healthcare, that's going to be a specialized tool of someone pouring only medical information and teaching the system about that. So, yeah. Well, thank you so much for coming. This was wonderful.
Yeah, really enjoyed it. Thanks for having me.